Heart disease is the #1 killer of most people in the U.S. That includes African Americans, Hispanics, and whites, according to the Center for Disease Control. Today, we're interviewing Dr. Kevin Smith, a facial plastic surgeon well known in Houston and nationally. What's not as well known is his personal journey to health. Today, we'll find out how this one physician is using a plant-based food solution to preventing and reversing heart disease.
Hello, my name is Dr. Kevin Smith. I'm the owner of Smith Center. I'm an ear, nose, and throat doctor and facial plastic surgeon. And I have a pretty interesting background I'm going to tell you about as it relates to food and my health. I was a football player at Dallas Carter High School in Dallas and got recruited to play at Michigan. So when I think about food, I think about our training table at that time. You know, we had a big German guy who would fix steaks and potatoes and all these things because we would burn, thousands of calories a day just working out. So you get into a habit of just kind of eating in volume. And of course, that changed when I got accepted to medical school. I wasn't working out as much because I'm studying a lot. And even during those times, I curtailed my eating. I wasn't eating so much food. However, I was still eating, meat, potatoes, desserts, and things like that. And it just got to be a habit, just like anything else. The same thing is true with all the holidays and what we would eat there. And it wasn't until I looked at several films just here recently about food. Forks Over Knives, and then the latest one I watched was What the Health, and those are on Netflix. And after the What the Health film, I kind of sat down and just kind of paused for a moment and asked, what am I going to do about my health as it relates to what I'm eating? Because everybody always says food is medicine. And I came to realize it really is, because after just 1 month of going on a plant-based diet, I lost 15 pounds. And that caused me to sit back and wonder, what is it I'm eating? Because I always thought I was an excellent eater. I love eating all types of vegetables, but I was eating dairy and I was eating meat. I love barbecue places. I'm a foodie. So, I'm always traveling around, especially in Houston, trying out new restaurants. I would know where the best restaurants were. I'm referring my patients to restaurants, the best barbecue, and so forth. But I think back to when I had an incident at age 39. I was examining a patient and I started having a little chest pain. And fortunately enough, there was a cardiologist right next door. So at lunchtime, I went to the cardiologist and they had me do a stress test. Well, the fellow there, when he looked at the stress test, he said, just a moment, I could tell he was a bit concerned. And he called his attending, who was my colleague, and he said, Doc, we have Dr. Smith here, and I have to tell you, his stress test is all over the place. His heart is doing all sorts of things. So with that, they recommended that I be admitted to the hospital. And so that was a wake-up call. So I'm sitting there in the hospital, and I'm thinking, I have my young daughters there, and my family, we're at the bedside, and the next day, I'm supposed to have this angiogram to check my coronary arteries. But in the back of my mind, I'm thinking, wow, if the coronary arteries are blocked, then I have to be looking at either getting a stent or having my chest cracked open to have bypass surgery. So fortunately enough, we did the angiogram. I wake up, I come out of surgery, and they say my vessels were clear. And that's the best news I could have gotten. But the question was, why was I having the chest pain? Well, it turned out to be stress related. And once I reduced my stress levels, all that took care of itself. But even since then, I'm 58 now, 59 now. Even since then, it's been 20 years. And it wasn't until this last year and a half that I really looked at my diet and said, I'm going to stop eating the dairy because frankly, it doesn't make sense for me as a human being to be eating and drinking fluid from a lactating cow. It just, to me, doesn't make sense. So I've switched to almond milk, which has served me just fine. By going to a plant-based diet, it's opened up a whole new realm of possibilities. I now go looking for vegan restaurants. And so those are places I've never gone to before, but there's some wonderful restaurants here in Houston that have wonderful entrees, wonderful burgers and sandwiches, great soups and salads, and they're very creative. And when you think about it, The thing I'm really looking for is to have the same textures, the same taste and flavors that taste like other things that I eat that might be meat. Vegan foods and vegetarian foods have come a long way. Now, we may not be as advanced as they are in California, but if you do your homework, you can find some wonderful, wonderful restaurants here, and then you can find some wonderful recipes as well. Even when I have patients that come in to me with sleep apnea, with trouble breathing, with heart palpitations, and things like that, it's not uncommon for me to get in a conversation about the movies I've watched, the foods that I've eaten, how I used to be a foodie in terms of looking for the best barbecue, looking for the best steaks in town, who has the best, tacos and everything like that. But now I eat vegetarian tacos, vegetarian enchiladas. It's not so much the meat, I don't think. In my opinion, it's more the meat and the way it's processed and grown here in the United States. Ever since we've got all the fast food industry, the meat industry has to keep up with them. So in order to do that, they have to grow chickens faster, they have to grow cows faster, pigs have to grow faster, and to do that, they use hormones and antibiotics. And those hormones and antibiotics are going to get passed down through the meat to you, and that causes you to have a little inflammation, weight gain, joint irritation. And I do believe this is my opinion. We're starting to see more and more younger people have strokes at a much younger age. And let's just talk about what I know about hormones and what they do to collagen. Collagen binds all of our tissues and makes them stronger. I use steroid injections in people who have thick scars because it helps to break those cross-links of the collagen. It makes the scars weaker and flatter. When I think about hormones that are used in animals, and you ingest those animal products, then why wouldn't the same thing happen in your blood vessels, where the collagen in the blood vessels gets a little weakened, so that when you have a normal blood pressure, you can have a stroke. Or if you get excited and your pressure goes up just for a moment, you can have a stroke. That's just my theory about it. To me, I know what steroids do. And if it does that with scars, it can certainly do that with tissues in your own body. And I think it can play a role in the development of strokes and aneurysms and things of that nature. I can tell you that I really feel much better about what I'm doing as far as eating vegan, vegetarian, or pescatarian. And I think if you're out there and you're suffering from chronic disease, arthritis, collagen vascular disease, diabetes, obesity, sleep apnea due to being obese or overweight, this is a wonderful way to start. I thought it might be hard to do, but it really isn't. You just have to make up your mind that it's something that you want to do, and just give it a try. Just give it a try for a month and see how you do. And it's not difficult to do. It allows you to explore other foods. But in the end, you'll find that you'll need less medications, you'll lose weight, you'll feel better, you'll sleep better, you'll have more energy, and who doesn't want to have that? My definition of life is that in itself. You have to have more energy and be able to enjoy your life so that you don't have these chronic diseases and you're taking all these medications to try to correct something that you can correct on your own, because it's been shown that on a plant-based diet, even coronary artery disease with plaques and buildup in your arteries can be reversed by simply stopping the meats and the animal fats that you ingest. And that goes for milk, that's yogurt, that's meat. But on occasion, I mean, you can treat yourselves. I have some friends of mine that do it during the week, and then on the weekends, they'll have a good steak. But certainly when you're going to eat that, you want to make sure that these are animals that are grass-fed, they're free-range, there are no hormones, they're not farm-raised fish, that these are wild-caught fish, because that's going to be better for you than the alternative. So with that, I can say I wish you a better life. I hope that you try being on a plant-based diet. I know it works. I know it'll make you feel better. and just give it a try, because it's really something worth doing.
I absolutely loved what Dr. Kevin Smith just shared with us, how he's using his own health as a teaching moment for all of us, and his success in reversing his own heart disease symptoms. Stay tuned for more of the above on my blog and author website, SherraAguirre.com, and in my upcoming book entitled Roots, Living a Healthy, Joyful Vegan Life, coming out in 2020. There'll be more stories, recipes, lots of good things to share with you. Thank you.